today to tell you about my friend Annabelle of Bellevue, Kentucky. Annabelle was born with Down syndrome, which is one of only a very small part of what made her extraordinary. The life expectancy of a person born with Down syndrome is 47 years. But Annabelle only got 3.5. She died after 5 weeks hospitalized fighting this virus. She suffered through being on a ventilator and having machines function for her heart and her kidneys. COVID robbed all of us of one of the most beautiful smiles you could ever see. And it robbed Annabelle of likely another 34 years to share it. A few weeks back, I took her parents, Jesse and Will, one of the flags that we saw every day on the Capitol lawn, marking COVID deaths in Kentucky. I spoke to Annabelle's mom, Jessie, this morning to ask her permission to share this story. And Jessie bravely said to me, if her story helps to save one child, our family would be so very grateful. Annabelle's smile was forever dimmed on December 2nd. I want you to think about that. December 2nd was before Delta. It was before kids were together in mass congregate settings. And it was with her family trying to keep her as safe as they possibly could, but this pandemic doesn't care. The only ways we have to protect each other right now are vaccines, distance, hygiene, and masks. A record high 2,396 children were hospitalized with COVID-19 as of Tuesday. Yesterday, Kentucky reported 4,468 new cases and 30 additional COVID-19 deaths, bringing us to just shy of 8,000 Kentuckians who have died in this pandemic. It is said that one death is a tragedy and thousands of deaths are a statistic, that we become numb to numbers this big. I'm not numb to this. I'm thinking about my friend Annabelle. Last year, I ended many of my floor speeches asking this question: does this bill save lives? I asked that of each of you on the very bills that brought us to this special session. So today I ask you all this: does this bill do enough to save lives? And how does this bill encourage vaccination or masking? Annabelle's mom ended our conversation today by saying that she would wear a mask every day of the rest of her life if it would give Annabelle just one more good day. Jesse, so would I. Members of this House, don't tell me this disease doesn't harm children. And don't you tell me that this bill is just a temporary fix that we can amend a couple months from now. This time, the time constraints that you all are putting on this extraordinary session, they're self-imposed. We don't have to end this session tonight or tomorrow. We could stay here until we get this right. Why aren't we doing that? Why are we gaming this system to rush through life and death decisions? Amendments have been filed that would make this a safer bill, adding flexibility at the local and hyper-local school level, but our locals are also asking us to give them cover where it's needed. Why aren't we considering that? I implore my fellow members to ask yourself a question I ask myself on a daily basis. What if I'm wrong? What if you are wrong? None of us are infallible. Because if we get this wrong, another Annabelle may die waiting for lawmakers to leave their egos behind and put their humanity forward. I cannot vote for this bill. I urge us to hit pause and get this right now before a child dies on what is now officially our watch. Thank you.